Madam Speaker, with your leave, I rise to have read a second time and to lead the debate on the bill entitled Nurses and Midwives Registration Bill 2023. Madam Speaker, as I've said, that this is not a controversial bill at all. I think that this bill gives the members of Parliament the opportunity to support a bill that really supports our nurses and midwives. It had been a matter, Madam Speaker, that had affected our nurses and midwives with respect to registration for some time. In the sense that when we looked at the past legislation, we recognized that nurses were asked to register yearly. It is not the norm of practice around the region and internationally to have nurses register yearly. One would admit that it carries a financial obligation. That's one. And secondly, it really does not enhance, in a sense, the proper flow and practice of such a noble profession. Before you register now, and in quick order, you are asked to register again. You see, it is important that registration does take place because monitoring is important. As a medical doctor and part of the healthcare profession, I am registered here in St. Kitts and Nevis, and I think I'm registered for life as a medical doctor. I am also a member of the American Board of Internal Medicine, and I have to do an exam every 10 years and prove that I'm active in practice. I think I have to write the board very soon, as time is drawing nigh, to tell them that I may not be as active as I used to, and to suspend in good faith until I can resume, if I so do. But the reason why I brought up that 10 years, that is a very long period of time. We have to sit an exam again to pass to be considered a certified medical practitioner in the United States of America. But apart from that, here in St. Kitts and Nevis, a doctor registers once. That's it. I don't remember if I even had to pay any money. Maybe I paid something. But the nurses are asked to register every single year. And even when you look at what happens across the region, and I sought to find a place across the region where nurses have to register yearly, I didn't come across any. But just in case there's one out there that I might have missed, I leave room to be corrected. And so a number of critical things, Madam Speaker, I think needs to be done to enhance the nursing profession here in St. Kitts and Nevis, which I'm 100% committed to. This being one of them. As you know, nursing organizations would have brought this issue forward over and over again. The Nurses Association would have also brought it forward. And we can remember when it was a matter that, especially when registered nurse, then the president of the association, Nurse Francis, would have made it a highlight of her manifesto during her run to become the president of the Nurses Association. And even subsequently to that, and before that, that it had been a particular matter for the nurses. And so I think that is only right that we look at the legislation. But I want to say that the council was contacted because things has to be done properly and in order. Even though sometimes you might have an excellent idea and a good intention, if it is not done in order, it can cause issues. And when that happens, nothing is wrong with recognizing that, reversing or taking a different course in making sure that the best result is achieved. And so today, I'm very happy to be able to bring this matter with the support of the council, the Nurses Council, that is, with the support of the Nurses Association, and you can see the nurses are here, well dressed as usual, and with the support of the ministry, with the support of the leadership at the community level, and I see the leadership from the community level and from the hospital level, they're also here, to really show that they welcome such a change. I think we need to put our hands together for the nurses. On both sides, we should do it. I didn't hear the opposite side. Thank you very much. As I said, Madam Speaker, we had the nurses here for a very long time. This is not intended to be a long debate, because I think that this gives us the opportunity, we on both sides, we can all agree that the nurses deserve this. I might be the one bringing it as the Minister of Health, but I think this, all would agree, we can unite on this one, come together on this one, show solidarity on this one to really support the nurses. And that from this day forward, the nurses in St. Kitts and Nevis will be asked to register every 2 years. Madam Speaker, I will not delve into any other thing with respect to the profession or anything surrounding it, because I will not introduce any point for there to be any controversy. I have the last say on this bill. I'm a medical doctor. I understand the profession well. And so I will leave it here so that we can all join in and show solidarity with no statement of controversy, so that we can all support. And I would like to see, Madam Speaker, in this House today, that government side and opposition side, when that question is asked, that all of us say, those in favor, all of us say aye together. Thank you, Madam Speaker. May it please you.